Welcome back to Dr. Sellers Educate. We're thrilled to have you back with us for this snapshot. We are going to be focusing on curriculum development. That is competency 4. If you have your candidate handbook out, you will notice that 17% of the exam questions will come from curriculum development. So you want to ensure that you're closing the gaps in this area. It's a very common area that many nurse educators don't have a whole lot of experience in, or they don't feel competent in this area. So if that's you, you're not alone. It's very common. And so that's why we're focusing on it today during this snapshot. Billings and Halstead is the reference that we're going to use for our time together in reviewing this topic. Chapter 6 specifically is going to give you some great content as a foundation for you to use in closing your gaps. And it starts on page 268. So curriculum development, specifically looking at the curricular design models. There are 3 design models that we're going to focus on, but just to set the tone of the review, we are responsible as faculty for the development, evaluation, and revisions of curriculums. And it's an ongoing process. It certainly starts with having a very solid plan in place for our curriculum. And it does develop a foundation of learning for our nursing students to be able to practice at the highest level. And we should consider implementing change theories as part of our rollout of any curriculum change, which we'll get to shortly, but just as an overview to kind of set the stage. And 3 change models I want to go ahead and make a note of for you. If you're not familiar with them, you want to take some time to review those. And that's going to be Rogers Diffusion of Innovations, Lewin's Change Model, and then SWOT. Those are all 3 good change models that we should use to help us move forward with curriculum design. A well-done design curriculum, as we said, is a key component as we establish this framework to support a solid nursing education. I also want to point out that we're going to talk about 3, but competencies are weaved throughout all models to some degree. We know that we have competency checkoffs, skills checkoffs that we have with our nursing students in the skills lab, and then we have a clinical evaluation as well. So there's competencies for all of the curriculum models that we're going to be taking a look at. When we are designing our curriculum, realizing that it is evolving and there are some components that we should consider that may be affected by our curriculum, to include our learners' needs, so understanding where their needs are and where their gaps are, as well as part of our curriculum design. What are our faculty's beliefs about the art as well as the science of nursing? We know there's value with both components. If you have not checked out our video, our snapshot on the science and art of nursing, make sure you do that. And if you have not subscribed to this channel on YouTube, Dr. Sellers Educate, then you want to make sure you do that as well. And then the third component is going to be the emerging needs of the populations that we serve. We know, for example, that in some nursing programs, using the block model, for example, which is the traditional model, it aligns didactic courses with clinical experiences. Some programs front load that didactic component and some of the simulation activities as well when they are thinking about integration of specific competencies. Clinical experiences are also aligned with, in a block model, with the didactic components. That's the goal. But we want to ensure that there's exposure across the care continuum for all curriculums, regardless of which model we choose. That's really important when we think about, again, ultimately the goal is that our students are able to graduate, pass NCLEX on the first attempt, and practice safely at a high level. The 3 models that we're going to talk about are the blocked, the concept, and the competency model. When we think about the blocked model, it is exactly that. There's blocks of nursing content, and it's based on specialty. So as we're talking through each of these models, you want to think about the differences between the 3, okay? That's going to help you better understand the actual model design and some of the considerations of that specific design. So each of them have, we're going to call them challenges and opportunities as it relates to our ability to help students learn and create that learning environment that supports clinical application. So blocking content is exactly what it says. The layout is very structured around the clinical specialty areas, patient population, pathological conditions, or physical systems. The block content does create a very rigid plan for learning. So there's not a lot of flexibility when it comes to making adjustments for learners' needs. So it can cause the content to be isolated from previous coursework. Sometimes the scaffolding that should happen in our courses, our individual courses, is not as evident. And we are sometimes just not sure about students' learning that has happened. And so that's where those competencies and checkoffs come into play. Another opportunity is the challenge that's associated with uncovering or identifying specific study knowledge or clinical performance gaps for our students. So for example, when a student fails a PEDS course, it's likely that it's not just about the pediatric course content, and oftentimes can be the safe patient care practices and the student's inability to really utilize clinical reasoning as we help close gaps for them. If they are missing a specific area of the clinical reasoning process, then the student is not going to be successful. So with this block course content model, those are just 3 of the challenges associated with implementing this type of model. Again, it's highly structured, number 1. Number 2, content can be isolated from previous coursework. And 3rd, when students fail, sometimes we're not always able to uncover exactly where the competency gap was. And all of this content, again, is based on Billings and Halstead, Chapter 6, the information that's shared there. Okay, here at Dr. Sellers Educate, we only provide content that is aligned with references that are recommended by NLN. All right, next, let's take a look at concept-based curricula. We are going to do a high-level overview. We're not going to go as deep into concept and competency-based curricula. However, if you do want to go deeper with us, we will be doing that at our next boot camp. So go ahead and head over to drsellerseducate.com, subscribe to the boot camp. It is a membership every month. You can cancel at any time, and there's 2 great benefits to the boot camp. Number 1, it's going to provide a community of accountability because we do meet every month. And number 2 benefit is that even if you can't meet during that time, all sessions are recorded. So when you join the membership, the benefit is that you will be able to have access of all of the previous recordings, including item analysis boot camp, which is another gap area. We spent 2 sessions actually taking a deep dive and looking at item analysis. Okay, so you want to head over to our website and join our membership, where we're going to take a deep dive and looking at the curriculum development, each of the 3 models that we're talking just a little bit about in our snapshot today. So let's get back to content. So concept-based curriculum, thinking about the approach. This specific model does better reflect the complexity of patient care that helps our learners grasp and connect concepts and support clinical application. So it helps them have a deeper understanding of the concepts. We know, based on our utilization of this model, the research tells us that there are common concepts that emerge when we look at a nursing program. Some of those key concepts and alignment with courses is listed in table 6.1 on page 272. It's the actual example from University of Kansas of a concept-based curriculum for BSN program. So for example, in looking at foundations, the specific concepts are going to be clinical reasoning, comfort, elimination, health promotion, etc. So you want to spend some time looking at that example as you think about the differences between each of these 3 models and some of those key differences. Again, the challenges and the opportunities as well. Competency-based education. Let's talk a little bit about this one. So CBE is defined as a framework for designing and implementing education that focuses on specific performance. The goal with CBE is that there are specific metrics, performance metrics that are identified, versus with the traditional education model, also known as the blocked content model. We develop our curriculum and our content based on learning objectives. Now, there again are competencies associated with them, but they're not as clear and precise in our traditional block model as they are in the competency-based model. Research does show that for some students, this is a great model and that there is learning that happens. However, for some learners' preferences, this is not going to be the best fit or the best model for them. All right, quiz time. Hopefully you all are very familiar with some of the key content that we've already talked about, but if not, that's why you're here, right? So let's take a look at a practice test question. So teaching and learning strategies are utilized to facilitate understanding of concepts that help students become users of knowledge. That's what it's all about, clinical application. So the best strategy to ensure students' knowledge of concepts will grow in depth and breadth is through A, integrating active engagement, B, mapping concepts, C, incorporating aspects of CBE, or D, utilizing clinical experiences. So I'll give you a chance to go ahead and look at those options and come back when you're ready. If you chose mapping concepts across the curriculum, you are correct. Again, you can take a look at Billings and Halstead. That is our source for this question. And make sure you close the gap if you did not get the answer correct. That was a tough question, I have to say. All of those choices were good, but the best one was centered around mapping. Curriculum elements. When we talk about the organizing framework, we want to ensure that, first of all, you understand what we mean by that, and then why does it matter? Why is it significant in a curriculum? Frameworks are used to help us identify the constructs that are embedded in our traditional philosophy statement in the nursing program. So all programs have a nursing philosophy statement. And the purpose is to design and develop and provide a mental model or picture for our faculty and students to help them really understand the value of nursing and how the knowledge that these students gain as part of the program, how it's going to connect with other knowledge that they learn, specifically with other disciplines. And it can also be as it relates to the university. Box 6.1 gives us an excellent example from PN Nursing organizing framework that they use. I really like the theme, which is one university, one school, one curriculum. And then the last component is going to be leveling of competencies. So just ensuring you understand the key concepts that are associated with leveling as well as mapping across the curriculum. We know that that's an important activity as well. What are the trends that are common in curriculum design? Chapter 6 is going to give you some great content related to that, but let's just take a quick look at some of those key concepts that you want to dig deeper into. First is going to be constructivism and narrative pedagogy. This states that knowledge is not simply absorbed, but it is created by and within the learner, with us as faculty kind of guiding how that learning happens. There are 4 components or criteria associated with constructivism: prior knowledge, cognitive dissonance, application and feedback, and metacognition. When we look at the definition of metacognition, this is when students are going to reflect on what they already know and think about why it's important to them. PBL, or problem-based learning, versus team-based learning. So we know when we talk about PBL, students learn through active engagement with meaningful work or meaningful problems, versus team-based is more learner-centered, with faculty serving as those expert facilitators. Flipped classroom, a very common teaching strategy that we're hearing more and more about, especially for our adult learners. It's going to assign pre-classroom activities and really use that in-person class time for the faculty to engage with students and helping them clarify questions that they have. But it just provides a better learning environment, active learning environment for students when they show up in the classroom. So just taking a look at some of those emerging trends as a follow-up from this session is going to be important as well. All right, well, that's our time for this session. We hope that this has provided either new content for you to help you close those gaps, or perhaps just validating some of the areas that you're already focusing on. Feel free to reach out to us. We are at info@drseuddseducate.com, and make sure that you head over to our website and look at all of the options that we have for the CNE exam prep, as well as the CNE novice. That's for nurse educators that have less than 3 years of experience, and then the clinical CNE as well. All right, until next time, thank you so much. Have a great one, everybody.